Welcome back to Wally's Nursing Videos. Today, we're exploring the topic of nursing care for patients with immobility and trauma. We'll cover the pathophysiology and impact of immobility and trauma on each body system, essential nursing interventions, and important diagnostics. Plus, we'll break down the different types of trauma to help you better understand what our patients may be facing. Let's jump in. Types of trauma first. Let's review the different types of trauma and how we classify them. Trauma can be classified in multiple ways, but two primary methods are trauma energy and type of injury. Trauma energy classification. High energy trauma. These injuries are typically more severe and can result in complex injuries across multiple systems. Examples include falls from a height, high-speed collisions, gunshot wounds, industrial or heavy machinery accidents, low-energy trauma. These are generally less severe, but can still have serious consequences, especially in older or more vulnerable patients. Examples include simple falls from a standing position or from a bicycle. Type of injury classification. Blunt trauma. This type of trauma is often associated with multiple widespread injuries because the energy of impact is distributed across a larger area. Blunt trauma can be from both high-energy sources, like car crashes, or low-energy sources, like a fall. Penetrating trauma. In penetrating trauma, the damage is usually more localized and follows the path of entry. Examples include stab wounds, gunshot wounds, rifle injuries. Pathophysiology of immobility and trauma on body systems. Now that we understand the types of trauma, let's look at how both immobility and trauma impact different body systems. Cardiovascular system. Immobility. With reduced mobility, blood pools in the lower extremities, which can lead to venous stasis and increase the risk of deep vein thrombosis, DVT. Immobility can also lead to orthostatic hypotension, where blood pressure drops suddenly upon standing. Trauma. Blood loss from traumatic injuries, especially high-energy blunt or penetrating trauma, can result in hypovolemic shock, which reduces perfusion to organs and tissues. For patients immobilized after trauma, the risk of DVT is also increased due to prolonged bed rest. Respiratory system. Immobility. Lack of movement decreases lung expansion, causing shallow breathing. This can lead to atelectasis, collapsed alveoli, and an increased risk of pneumonia as mucus accumulates in the lungs. Trauma. Injuries to the chest, such as rib fractures or pulmonary contusions from blunt trauma, can impair lung function. In cases of severe trauma, the inflammatory response may lead to acute respiratory distress syndrome, ARDS, where the lungs cannot effectively exchange gases. Gastrointestinal and metabolic system. Immobility. Without regular movement, digestive processes slow, leading to constipation. Over time, bone density decreases, resulting in possible hypercalcemia. The metabolic rate also drops, which can contribute to weight gain and muscle wasting. Trauma. Trauma increases the body's metabolic demands to support tissue healing, leading to a hypermetabolic state that requires additional protein and calories. Patients immobilized post-trauma are also at risk for paralytic ileus, where the intestines stop moving, causing bloating and discomfort. Genitourinary system. Immobility, urinary stasis, or the inability to fully empty the bladder, raises the risk of urinary tract infections, UTIs, and kidney stones, as stagnant urine encourages bacterial growth and crystallization. Trauma. Trauma, especially with significant blood loss, can cause acute kidney injury, AKI, due to reduced perfusion to the kidneys. Additionally, pelvic trauma may directly damage the urinary system, leading to complications like retention or infection. Integumentary, skin system. Immobility, pressure ulcers or bed sores, develop due to constant pressure on bony prominences, reducing blood flow and causing skin breakdown. This is a major risk for immobile patients. Trauma. Open wounds and abrasions from penetrating injuries or lacerations from blunt trauma increase the risk of infection. Immobilization following trauma also contributes to pressure ulcer risk. Key nursing interventions for immobility and trauma patients. Now, let's talk about nursing interventions that can make a huge difference for these patients. Our role as nurses includes assessing for complications, managing symptoms, and preventing further injury or issues from immobility and trauma. For immobility, skin integrity, and pressure ulcer prevention. Repositioning, move patients every 2 hours to relieve pressure. Use pillows or other supports to cushion bony areas like heels, elbows, and the sacrum. Skin checks. Assess skin daily, looking for redness, blanching, or other signs of early skin breakdown. Support surfaces. Low air loss mattresses or pressure-relieving devices help distribute pressure evenly and reduce skin breakdown. Respiratory support. Incentive spirometry. Encourage deep breathing exercises using an incentive spirometer to expand the lungs and prevent atelectasis. Coughing and deep breathing. These exercises help clear mucus and prevent pneumonia. Early mobilization. Progressing patients gradually from bed to chair to walking decreases respiratory complications. Musculoskeletal support. Range of motion, ROM. Exercises. Perform passive or active ROM exercises to maintain joint mobility and prevent contractures. Physical therapy. Involve PT to develop an exercise plan for safe mobilization and to strengthen muscles. Cardiovascular support, DVT prevention. Use compression stockings, sequential compression devices, SCDs, and encourage leg exercises to prevent venous stasis. Gradual position changes. Moving patients slowly from lying to sitting reduces the risk of orthostatic hypotension and dizziness. Psychological support. Patient engagement. Involve patients in their care plan, set goals, and encourage participation to promote mental well-being. Family involvement. Encourage family visits and involvement to prevent isolation and support mental health. For trauma patients, neurovascular assessment. Frequent monitoring. Check circulation, sensation, and movement, especially in limbs with fractures. Assess for the 6 Ps: pain, pallor, paresthesia, paralysis, pulselessness, and poikilothermia. Compartment syndrome monitoring. Compartment syndrome is an emergency. Look for pain out of proportion to injury and take immediate action if suspected. Pain management. Multimodal pain relief. Combine medications like opioids, NSAIDs, and non-drug methods like ice packs and elevation to effectively manage pain. Sedation and neuroassessments. In cases of head injury, monitor sedation levels closely and perform frequent neurological checks. Prevention of complications in head trauma. ICP monitoring. Increased intracranial pressure, ICP, is a major concern in head trauma. Look for signs of Cushing's triad: elevated blood pressure, bradycardia, and irregular breathing. Head elevation. Keep the head of the bed elevated at 30 degrees to reduce ICP and promote venous drainage from the brain. Diagnostic indicators for immobility and trauma. Let's finish up with some essential diagnostic tools used for assessing immobility and trauma-related complications. Immobility complications diagnostics. Basic metabolic panel, BMP. Monitors for electrolyte imbalances, which can be caused by inactivity and inadequate nutrition. Complete blood count, CBC. Detects signs of infection, especially for conditions like pneumonia or UTIs, which are more common in immobile patients. Skin and wound cultures. If a pressure ulcer or wound shows signs of infection, cultures help guide antibiotic therapy. Trauma diagnostics, head CT or MRI, used in cases of head trauma to identify bleeding, swelling, or fractures. Compartment pressure monitoring. High pressures over 30 mmHg in a limb indicate compartment syndrome and require immediate intervention. Increased ICP measurement. Ventriculostomy or ICP monitors help detect increased ICP, and high readings necessitate urgent care to prevent brain herniation. Key takeaways: immobility and trauma can have widespread impacts on patients' bodies. As nurses, we can play a vital role in assessing, intervening, and preventing complications for these patients. Remember, reposition frequently to prevent pressure ulcers. Encourage breathing exercises to reduce respiratory complications. Watch for neurovascular signs, particularly in trauma patients at risk of compartment syndrome. Use diagnostics like BMP, CBC, and imaging to detect complications early. Thank you for watching this comprehensive overview on nursing care for patients with immobility and trauma. If you found this video helpful, please like, subscribe, and stay tuned for more nursing education right here on Wally's Nursing Videos. See you next time.